Batul, we are live.
Assalamualaikum everyone. My name is Batul Mirza, and I'm here today with Dr. Jennifer Glazer. Dr. Jennifer Glazer is one of the top MAPS doctors in Canada, and I've had the pleasure of working with her personally for my son, Ayan, as well. वैसे तो Dr. Glazer को किसी बहुत ज़्यादा तारुफ की ज़रूरत नहीं है, but she's been practicing for the past 21 years in the field of naturopathy, as well as she specializes in autism. एक चीज जो डॉक्टर ग्लेजर की मैं कहूँ यूनिक है is the fact कि वैसे तो बहुत सारे डॉक्टर्स मिलते हैं जो आपके लिए ट्रीटमेंट और इलाज आपका करना चाहते हैं और सिंसियर भी होता है, but Dr. Glazer uniqueness, I would say, is that she takes the time to teach you and educate you about what she's doing. And for parents like us who have children on the autism spectrum, something like this is very useful because हमें भी अपनी education का मौका मिलता है, ये समझने का मौका मिलता है कि हम किस चीज को address करें. So today's topic is the microbiome and mental health, and how the microbiome affects the health and the mental health of our children. Dr. Jennifer Glazer has prepared this presentation and she is very excited to share this with us. But before we begin, I'd like to hand it over to Alina ताकि वो भी 2-3 जुमले बोल सकें. Go ahead, Alina.
Assalamu alaikum everyone. I hope aap sab theek hai. It's such a privilege for us that Dr. Glazer has joined us on this forum. I'm sure you are going to learn a lot from her. Our microbiome, as you all know, is the base of our children's health, especially when it comes to autism. We all know our gut health plays a very important role. And I'm sure today when you're going to hear from Dr. Glazer, you will learn more things, how you can take care of your children, how can you take care of their gut health. So over to Dr. Glazer. You are most welcome to start. Thank you so much once again for coming.
Thank you for having me. I'm really pleased and excited to be speaking with all of you today. I just want to take a step back and talk about biomedical treatments for children on the autism spectrum. I think the important thing to note about biomedical treatment is that we are treating every child as a unique individual and looking for the root cause of illness. And I think that's the whole premise of what biomedical treatment is. I mean, it's a big fancy word, but really it's just trying to figure out what the root cause or imbalance is in every individual child, and peeling away at the different layers and figuring out what the problem is. And looking at the microbiome is one of my top priorities of treatment when it comes to children on the spectrum, but it's not the only aspect of biomedical treatment. It's probably the foundational and the most important aspect, but it's not the only. There's also mitochondrial dysfunction that is really big in biomedical treatment. There's heavy metal detoxification and chelation, which is also a big factor in the development of autism. There's diet, which is a big foundational treatment. And there's just like a vast array of treatments within our toolbox. And the gut health and the microbiome, I think, is the most important, and that's what we're going to speak about today. So I think we're going to get right into it. Is that okay, Batul?
Yeah.
Okay. All right, so let's go to my first slide. So what are we going to be speaking about today? So my hope is that everyone gets a better idea of what the microbiome is and some of the factors that are affecting it. And then I will also explain the connection and show some valuable research on the microbiome and how it relates to behavior. Then I'll speak about some of the clues and how even without testing your child with elaborate lab testing, how you might figure out or the clues to microbiome disruption, some hints that might make you think that, yes, I think my child might have some gut issues. Then we'll talk about what is leaky gut or intestinal permeability, and some ways to improve the microbiome and to treat leaky gut or intestinal permeability. So that's sort of the overview and the highlights of what I want to speak about today.
And can I ask everyone who's joined here today to please mute yourselves so we can listen to Dr. Glaser uninterrupted. Thank you very much.
Okay, next slide. Okay, so what is the microbiome? The microbiome, believe it or not, is a bunch of various different microbes, basically, in our gut. And humans are mostly made up of microbes. We have over 100 trillion microbes in our body. And the microbes in our body actually outnumber the number of human cells 10 to 1. So if you just think about that, there's more microbes in our body than cells. So manipulating the microbes in our body can have a profound effect on our health. The majority of the microbes that I'm speaking about live in our gut, but you can also find them on our skin, in our lungs, in our mouth, in our eyes. So they're everywhere. But we're going to be sort of focusing on the microbes that reside within this GI tract. So what do these microbes do? What are their function within the body? Well, they are important because they provide protection against various pathogens. They're sort of our first line of defense. They also regulate our immune system. They produce different types of vitamins like vitamin B12 that everyone is so, familiar with. Everyone speaks about the importance of B12. Well, if you don't have a proper functioning microbiome, then you're not going to even produce any B12 innately within your body. Also, the microbiome is really important for early brain development and hence subsequent adult behavior. Now, there's an interesting study that was done. This was done in mice, and they took germ-free baby mice and germ-free adult mice. And when they fed them different probiotics, they found that there was a profound effect on the baby mice's behavior when they, re-inoculated them with good bacteria, but there was no change in the adult behavior of the mice. So what this tells us is that there's a very critical window where we can work on the microbiome, and that can have an effect on a child's behavior. But there comes a point where it's almost like we miss that window. It doesn't matter what we do with the gut or how we manipulate the microbiome, it doesn't seem to have the same effect. So I think that was an interesting study just to illustrate the importance of early treatment. The microbiome also helps with waste removal and removal of toxins and digestion of our food. It's also really important when it comes to the transport of different vitamins and minerals and motility. So it helps move the waste along. Okay, let's go to the next slide. So what are the factors that affect our microbiome? Well, the microbiome is basically can be affected from, well, actually it's studies are showing that it's actually can be affected in utero. So the health of the mother's microbiome while she's pregnant is extremely important because she passes on basically what's in her gut to her children's gut. But even at birth, you know, the type of delivery, whether it was a C-section or vaginal delivery, determines the type of bacteria that the child's going to be exposed to. So if, you know, the child is born by C-section, they're going to be predominantly exposed to Staphylococcus bacteria. Whereas if a child is born through the birth canal, they're going to be predominantly exposed to Bifidobacterium. So right from birth, you can see that you can affect the species living in your GI tract. Also, if a mother is given a lot of antibiotics at birth or during the pregnancy, that will affect the child's microbiome. If a child is breastfed or formula fed, that will affect the microbiome. And studies have shown that breastfed infants, again, have a predominance of Bifidobacterium in their GI tract, whereas children that are formula fed tend to have a microbiome that resembles that of older children and an increased amount of Clostridial species within their gut. And we know, you know, from treating children for 20 years or so, I'm always seeing from the different lab testing that I do, children on the spectrum tend to have problems with an overgrowth of Clostridia bacterium within their gastrointestinal tract. And this can be sort of tracked back to perhaps, you know, they were introduced to formula a little bit too early. Also, water. Our water source is a really important thing because our tap water has chlorine in it. And we know that chlorine is used in pools, for instance, to kill off, you know, harmful bacteria. Well, if we're drinking that chlorine in our water, it's affecting our microbiome. It is killing off parts of our good bacteria and unfortunately creating a dysbiosis. So drinking properly filtered water is really important. Our diet is also really important, whether you're eating organic foods versus non-organic foods. Our foods that are heavily sprayed with herbicides and pesticides are meant to kill different types of microbes. So, you know, when you ingest those foods, it's affecting your microbiome. The amount of fiber in your diet is really important. Eating a high fiber diet, there are studies that have shown that this helps the good bacteria to grow within your gut. So I think these things are really, really important for the future generations that, you know, haven't been born yet, for moms to be aware of these things that can affect the health of, you know, your children going forwards. And these are just some simple things that we can control to give our children the best start in life. So, okay, so I'm talking about the microbiome and all the things that affect the microbiome, and we're aware of these things now, and that's great, but why do we care? Why does it matter that we have a healthy microbiome with all the proper bacteria and the proper levels, and not, you know, having what we call a dysbiosis within our gut? Why does that matter? Okay, next slide. It matters tremendously because there is an immense amount of research out there now that's linking gut microbiota specifically to behaviors and the development of brain function in our children. I mean, the world of research in this area over the last 10 years, it's astounding how much research is going on right now. And they're finding that there's an intricate relationship between the gut and the brain. And the data is suggesting that the microbiota in the gut can regulate anxiety, can regulate your moods, can regulate cognition, and even pain perception. And the way that the microbiota do this is through neural, endocrine, and immune pathways. So this is just a study. This slide is just showing one of the many studies that suggest that manipulating or modulating the gut microbiota, that they're saying it may be a strategy for dealing with complex central nervous system disorders. So, I mean, this is pretty groundbreaking that orthodox medicine is starting to realize. I mean, we were doing this, 20 years ago when I graduated, but the fact that they're coming around now with all these research papers backing this is just fantastic. Let's go to the next slide, and it's also showing more research, specifically showing us that obsessive compulsive behaviors. Okay, this was a study that was done in mice, but they found that simply by giving them Lactobacillus rhamnosus, which is a specific probiotic species, that they were able to modulate OCD-like behaviors in these mice, and it was comparable to fluoxetine. It actually did better than fluoxetine in modulating the obsessive compulsive behaviors. So, I mean, that's an incredible study. And on next slide, you'll see another study that's, again, using the same species. I believe they used Lactobacillus rhamnosus in this study. And they showed that by treating, I think it was done in mice again. Let me just check. Yeah. They were able to affect the GABA receptors in mice through vagus nerve modulation. So by the Lactobacillus rhamnosus is an incredible bacteria to help deal with our kids on the spectrum who have a problem with a GABA glutamate imbalance, right? Like, how common is hyperactivity in our children? Well, that can just be stemming from a dysbiosis in the gut, and by using and modulating it with different types of bacteria that are known to affect the GABA receptors can have a profound effect on behavior. So I think that this is a pretty incredible study. We also know that there is a bidirectional communication between the species of bacteria in the gut through the vagus nerve. So, I mean, there's countless studies showing that there is an intimate relationship between the gut through the vagus nerve, and it directly communicates with the brain. So there's a lot of different species within the GI tract that can modulate these neurotransmitters. For instance, the lactobacillus species, which I think everyone is very familiar with, can help produce acetylcholine and GABA within the gut. The bifidobacterium is also really important when it comes to producing GABA in the gut as well. So that can help modulate hyperactivity. So simply by using something like Lactobacillus rhamnosus and bifidobacterium in our children can really profoundly help with hyperactivity, ADD, ADHD, and help calm kids down. So I think that's a really important study. Okay, next slide. So without having to do all of these elaborate tests like the GI map test and the OAT test and the comprehensive digestive stool analysis test, how do we know if our kids are suffering from what I call a microbiome disruption? What are some of the hints or some of the clues that might sort of pique your interest and let you know that my child might be suffering from a problem within their GI tract? If your child had persistent colic as a baby, if they were crying relentlessly for no reason, that's a good clue that there's probably something wrong with their microbiome. If your child had a lot of reflux growing up, that's a sign that there's problems with the microbiome. If you had a history of thrush or severe diaper rashes, if that was a constant problem for your child, it's likely that there was some yeast overgrowth due to microbiome disruption. That can also be, a result of perhaps overuse of antibiotics that can skew a child into developing an overgrowth of yeast. Does my child have a lot of food sensitivities? Are they reacting to a lot of different foods? That could be a clue that there's a problem with the gut and the microbiome. Do they have an insatiable appetite? That's usually a sign that there's an overgrowth within the gut, because they need a source of fuel. So they are constantly needing sugar and carbohydrates to survive. So they're making your child insatiably hungry. So they have a ravenous appetite. So that's also a sign that there could be some overgrowth going on. Okay, next slide. Is there a failure to thrive? Did your child suddenly fall off their growth curve? Were they, growing really well, and then all of a sudden they were at 50 percentile, and then all of a sudden they were at the 10th percentile for height? That can be a sign that there's a problem with their microbiome. A long history of ear infections and excessive antibiotic use, that will definitely create disruption within the microbiome. Abnormal posturing, what does that mean? That if you find that your child is sort of leaning over on the sofa, the arms of the sofa, and pressing into their abdomen, that's usually a sign that they're in pain. You can often see excessive bloating, gas, and this can be a sign that the carbohydrates that they're eating are fermenting within the large intestine and creating a lot of bloating and gas and pain. So they have this, what we call abnormal posturing. They're either always lying down on their stomachs, or they're pressing their stomachs into the furniture, essentially, because they're in pain. So we see that a lot. You'll see a lot of self-injurious behaviors, head banging, biting, things like that. And then again, we'll also see sleep issues in these children. And so many of the kids that I see have sleep issues. We know that 80% of the serotonin in our body is made in the gut. And also we know that the tryptophan metabolism occurs in the gut. That's one of the functions of the bacteria in our gut. And this is involved in the production of serotonin. And serotonin sort of goes down a pathway to produce melatonin. So if we're not producing serotonin, then we're not producing melatonin. And then the kids are going to have all kinds of sleep problems. You'll find that once you sort of treat the gut, heal the gut, sleep suddenly improves. And I mean, that's just a fantastic thing, not only for the kids, because you need your sleep as a child. I mean, that's when your brain detoxifies and it's regenerative, but I mean, the parents also need their sleep. So, and it's also been shown in different studies that kids on the spectrum have a lower amount of urinary excretion of melatonin. So we know that their guts are disrupted and they're not producing the right amounts of serotonin. Okay.
I might just take a minute, Dr. Glaser, to recap,
Yeah.
especially this piece over here. We get lots of questions around the fact that, how do I know that my child has gut issues? Because, you know, he's pooping okay, he's going to the toilet fine, sleep is fine, he eats okay. How do I even know? So I think जो चीज जो यहाँ पे Dr. Glaser emphasize कर रही है, and she's even shown through research papers here, कि आपका gut microbiome का direct link है आपके brain से, right? So it's not just going to be कि gut के अंदर issues क्या हैं. It could be an overall behavior of your child as well. So
Right.
she's listed the clues of microbiome disruption over here on this slide, which you all guys can see. History of ear infections is there. Poor sleep is a huge puzzle piece to that. तो आपको हमेशा जरूरत नहीं है कि आप स्टूल टेस्टिंग कराएं या कोई बायोमेट्रिक टेस्ट कराएं अगर आप अफोर्ड नहीं कर सकते. It is possible for you to observe your child and see कि उनको आपके इंडिविजुअल चाइल्ड को क्या नीड्स हैं और वो आपके माइक्रोबायोम का इंडिकेशन देंगी आपको.
Yeah, and I think I missed, I think another important piece is skin.
Oh, yes.
Eczema, things like inflammatory skin reactions and hives and things like that. That's a big piece as well, a big clue that you might have something going on with the gut. So I did miss that. I apologize, but that can definitely be added to the list.
Yeah, those are very important indications, because most of the time we're only looking at what's in front of us, that, oh, you know, it can't really be gut because he goes to the toilet twice a day and I don't really see a problem. But there is, you have to look deeper.
You have to look deeper. You have to look a little bit outside the box. Yeah, I agree 100%. That's a good point. Okay, so moving on to the next slide. This again is just showing you the data that's out there. I mean, I just picked a few. There's just so much out there showing the relationship between dysbiosis. Dysbiosis is basically, it just means an overgrowth of a specific type of bacteria or yeast. It can refer to yeast in the gut. And its relationship to autism in particular. So there's even research out there now linking dysbiosis to the development of autism. And just looking at some of the research, in 2004, which is like a long time ago, they showed that kids on the spectrum had altered bowel flora. They also showed in 2002 that these kids on the spectrum tend to have an overgrowth of Clostridia. They also showed in 2017 that there was an increased incidence of yeast overgrowth in kids. And I mean, I run the O test on almost every child that comes through my clinic. And I would say 98% of the kids coming through have elevated arabinose, which is an overgrowth of yeast. So it's incredibly common for these kids to have a yeast overgrowth, and that can be the root cause of so many of the symptoms. Here's another one showing that Clostridia species are shown to produce propionic acid, which is neuroinflammatory. It has neurotoxic effects on the brain. And they also have evidence now of showing increased incidence of mycoplasma bacteria in children on the spectrum. So There's a lot of data now that is linking dysbiosis as a possible cause of autism spectrum disorders. So I think that's pretty incredible that there's research backing this now. Also, it's interesting to note that in some of the studies that I was sort of scouring before this presentation, it was shown that a lot of kids on the spectrum have a lot lower amounts of bifidobacterium, and Akkermansia bacteria is commonly found to be decreased in children with autism. And it was also found that they had higher amounts of lactobacillus and provotella species, along with yeast and Clostridia species at higher levels. So it's not all, not all the studies are agreeing with one another, but this was pretty commonly found throughout the studies, those sort of things that I just mentioned. So let's look at another study in particular. This study, hold on a second. This is an interesting study because it looked at a possible link between early probiotic intervention and the risk of neuropsychiatric disorders in children. And they found that probiotics, when they are introduced early into life, in a child's life, and specifically the bifidobacterium, which I spoke about, it helped reduce the risk of neuropsychiatric disorders in children later in life. So I think that's really important. Again, emphasizing how critical it is for early intervention. And again, it's this bifidobacterium that we get from the vaginal birth canal, from breast milk. So again, bifidobacterium is a big player when it comes to autism spectrum disorders. Okay, so let's leave behind some of the, the research and the data, and let's talk about leaky gut. So let's go to the next slide. And I want to try to explain to everyone what is leaky gut or intestinal permeability. I'm sure you've heard about it. People speak of it all the time, but what exactly is it? Leaky gut is a condition in which the lining of the intestine becomes damaged. So if you look at this slide, on the left-hand side, you can see the cells of the intestinal tract are all aligned, and there's no sort of gaps in between each cell. If you go to the right-hand side of the slide, the more red and inflamed cells, you can see that there's little gaps in between each cell of the intestinal tract. Now, these gaps allow food particles, toxic waste, and bacteria even to leak through the intestines and flood the bloodstream. Now, these are not things that are supposed to get into the bloodstream. They're supposed to stay in the GI tract, and these foreign substances entering the blood cause immune reactions in the body. And that's an inflammatory reaction or an allergic reaction. And you can start to see symptoms result from that, such as migraines, even eczema, right? There's the skin piece again. A child could be chronically fatigued. You start to develop food allergies, arthritis, joint pain. I mean, the list goes on and on. So it's really, really important to have these cells of the intestinal tract healthy and no gaps between them to allow different substances to enter the bloodstream that are not supposed to be there. So how exactly does this happen? how do these cells sort of pull apart like that? Well, there's a toxin that pathogenic bacteria in the gut release called zonulin. So when we have an overgrowth of bacteria in the gut, meaning we have these bad guys in our gut, they release different toxins, and it sort of drills into the cell lining of our intestinal tract and creates all kinds of inflammation. And then we start to get these gaps. So that's why the microbiome is so important. We don't want to have an overgrowth of these bad bacteria because they start to create this leaky gut. So I think that's an important thing to remember. A dysbiotic overgrowth in the gut leads to intestinal permeability. And then it starts to create all these extra intestinal type of symptoms, like you might get a headache, or you might see eczema, or then you might start to see behavioral things, because guaranteed, if the gut is leaky, the brain is leaky. So here's our next slide, shows actually proof or evidence that changes in the gut flora, as I just spoke about, leads to gut inflammation and ultimately a leaky gut. If your gut is leaky, you end up with systemic inflammation, which all of these cytokines sort of travel along the body. They cross the blood-brain barrier and they create inflammation within the brain. When there's inflammation in the brain, that's when you start to see behavioral changes. So I think what you have to understand is, and then I think the take-home message from this entire lecture is, when you have a gut that's on fire, your brain is on fire. And I think the next slide sort of drives that message home. A gut on fire means the brain is on fire. There is a very intricate relationship between the gut and the brain, and it's a bidirectional signaling that takes place between the gut and the nervous system. They've even named it now. It's called the microbiota gut-brain axis. And the gut microbiota has a profound influence on brain function, and it leads to changes in behavior. So I think that's sort of the main take home. I don't know if you want to translate any of that, but I think I really want people to understand that the whole reason behind treating the gut is because it has a profound effect on the brain.
No, I think we're good to proceed with these ones, like with the pictures and stuff. I think it's
Makes sense.
Yeah.
Okay. So now that we sort of understand the whole connection between the gut, the importance of the health of the gut, what can we do to improve the microbiome? Well, there's a ton of things that we can do to improve the microbiome, and I'm going to speak about a few of them. First and foremost, we can obviously introduce probiotics. And there's a ton of probiotics out there. And those will improve the gut ecology, and they will lower inflammation for sure. They will also help support digestion within our children. And that will all help produce different vitamins that we need, and in particular, short chain fatty acids, which are really important. They will also enhance immunity. Another way to improve the gut microbiome is to introduce fermented foods into the diet. Fermented foods can include things like kimchi and homemade sauerkraut, kombucha, coconut kefir, and those are fantastic and really, really healing. The only thing I would mention about fermented foods is that they don't work for every child, especially kids with histamine intolerance or histamine issues. Fermented foods are high in histamines, and they can actually aggravate some children. So just a cautionary measure there that, yes, I'm saying, you know, eat these foods, but it's not, you know, a blanket treatment for every child. So I think it's important to realize that every child has a different biochemistry, and what works for one child isn't necessarily the approach for another child. So I'm saying these foods are great. They help improve the healthy gut bacteria, but again, they don't work for everybody. Okay, next slide. Another way to improve the gut microbiome is to introduce some beneficial yeast called Saccharomyces boulardii. I like this because it competitively inhibits Candida species, and it competitively inhibits Clostridia species. And, you know, a lot of kids on the spectrum have issues with both Candida and Clostridia bacteria. So I'm often found to be using Saccharomyces in a lot of the protocols that I work up for my kids. Saccharomyces is also really great because it improves the secretory IgA within the gut, and that's sort of our first line of defense, the immune cells within the GI tract. It also helps to improve mucosal repair. So it's a really, really important tool within our toolbox. And a typical dose of Saccharomyces is usually around 250 milligrams per day. Again, depending on the child's weight and their age, that can go up or down, but a good dosage is around 250 milligrams a day of Saccharomyces boulardii. Okay, next slide. Other simple ways to improve a child's microbiome is to drink good quality filtered water, right? We want to make sure that there's no chlorine in the water. That's really, really important. Try to avoid using hand sanitizers. I know now more than ever, I mean, hand sanitizers are everywhere. The triclosan that's in these hand sanitizers are absorbed through the skin into the bloodstream. And yeah, they're killing the bacteria on your hand, but they're also killing the bacteria in your gut. So I get that they need to be used sometimes, but just good old fashioned warm water and soap, you're much better off just washing your hands rather than using these hand sanitizers. So if you're in a place where you can't and you have to use the hand sanitizer, fine. But I would really limit your use of hand sanitizers and constantly using those antibacterial wipes in your home. It's just not a good practice. It's killing all the bacteria within your gut. Let your children play in the dirt. We don't do that enough today. So that's really important. Having pets in your home. There's countless studies showing that having a dog in your house really benefits children's microbiomes. Eating organically is really important, organic meats in particular. There's mounting evidence now that glyphosate alters the gut microbiome in a very negative way. I mean, does a ton of other negative things as well, but the microbiome in particular, it's been shown to affect the microbiome as well. And glyphosate is in so many foods now. It's in corn, it's in wheat, which is probably one of the reasons why avoiding gluten and wheat is so profoundly effective and helpful for these kids. It could be improving their microbiome just by getting rid of some of the glyphosate in their system. Flax and oats are highly contaminated with glyphosate as well. There's a really great website called the Detox Project And I think that's put on by the Environmental Working Group. And they talk about the foods that are highly contaminated with glyphosate and things that you can do instead. Okay, next slide. So those are some of the things that you can do to try and preserve your microbiome. Now we're going to sort of switch gears a little bit and talk about some of the treatment strategies for a leaky gut. So there's a 4R treatment. I call it a 4R treatment, and it's pretty standard. I think every naturopathic doctor has heard of this, and it's nothing new. I didn't make it up, but it's a really great acronym to help remember what to do for a leaky gut. So the first R stands for remove. And what you want to do is remove all the inflammatory triggers, such as different bacteria and yeast, viruses, fungi, and parasites. You want to remove any food additives, and again, food allergens as well. At this point, you can consider using antimicrobials to, if there is an overgrowth of bacteria found within your child, you can use natural antimicrobials, and you can use things like something like garlic. Even cooking with garlic is a fantastic way to introduce gentle antimicrobials into a child's environment. You don't want to give antimicrobials simultaneously with calcium or iron or magnesium. You want to give them 2 hours apart because well, I'm not sure why I wrote that. Let's just ignore that comment for a minute. But you want to consider pulsing natural antimicrobials. And by pulsing them, you want to sort of use them for a few days and then switch to something else. And that avoids any resistance that the bacteria in the gut might develop to the antimicrobial that you're using. You want to also tend to give these 20 minutes after a biofilm disruptor. And there's lots of different natural biofilm disruptors, and just using stevia as a sweetener is a really great way to break up that biofilm. And the biofilm, if people aren't sort of aware of what the biofilm is, it's where all these bacteria hide. And that's the way they hide from your immune system and from antimicrobials. So you have to get rid of this film that sort of lines the intestinal tract, so you can expose all of these bacteria and that they'd be more susceptible to these killing agents. So,
Dr. Glazer, would you say that biofilm, basically the bacteria hide in there and it's difficult to break that without using something, right? Like
it is, yeah. Unfortunately, they do hide, and that's why you can do like a antimicrobial sort of protocol, and then things can resurface. It's because they were hiding, waiting for a good time to come back out and resurface.
Like
so
a film around them, which
exactly, yeah, that's how they hide. Something like apple cider vinegar could be used as a biofilm buster. Stevia, as I mentioned, and digestive enzymes taken on an empty stomach. And that's key, because if you take it with food, it'll break down the food. But if you take it on an empty stomach, the biofilm, those enzymes will break up the biofilm. It'll eat away at the biofilm instead of digesting the food.
Since we're talking about enzymes, and I know we're leaving the questions till the end, but there was a question about the camel milk, because it's readily available in Pakistan. So we just want to make sure, can camel milk be used to improve gut health, and your views about it?
I think so, yeah. I mean, I don't know the exact constituents of camel's milk and why it's so effective in our children, but I have heard sort of anecdotal evidence that it is really beneficial with constipation, and it's used a lot in treating PANS and PANDAS. So I do think that it does have an effect on the microbiome. I just don't know the exact species that are in it. I don't know that there's been an analysis of camel milk. Maybe it's something I could look into, but I think there's anecdotal evidence that it is effective.
Thank you.
I just want to take a moment on the next slide to talk about the diet. So, you want to remove allergens and you want to remove food additives like emulsants and dyes and food coloring, and MSG is a big one. But what sort of foods should you be eating in this stage of treatment? And if you just flip to the next slide, there's a food pyramid here showing that a Paleolithic diet would probably be your best bet. And that's a diet that focuses heavily on dark green leafy vegetables and proteins. And why, you might be asking me, why are you, taking out all the grains and not focusing on the grains? And because studies have shown that kids on the spectrum have 10,000 times the amount of gram-negative bacteria in their gut. And we know that the food we eat supplies the fuel to the bacteria in our gut. So when we start eating a lot of carbohydrates and they start fermenting and we're not digesting it properly, it feeds Clostridia particularly. So the more carbohydrates we eat, the more these bacteria flourish, and then they release harmful toxins and the cycle continues. So if we can remove or limit, at the very least, limit the carbohydrates in the diet, it helps to sort of starve out these bacteria. And that is best done with a Paleolithic diet, or it can even be called a specific carbohydrate diet or the caveman diet. So limiting carbs is always a good option when you're sort of doing some gut treatments. Okay, so what does the second R stand for? The second R stands for replace. And in this part of the treatment, you want to start replacing the digestive enzymes and some supporting, giving supporting nutrients to the body to help with the healing process. You want to give enzymes like proteases to help digest protein, lipases to digest fats. You want to give nutrients that will help heal the intestinal lining. Vitamin D is really important for that. Zinc, carnosine, vitamin A, your essential fatty acids, and the different B vitamins. So those are some of the essential nutrients to help with the gut healing. The third stage is repair. And in this part of the treatment, you basically focus on, again, different supplements that help to restore the integrity of the gut mucosa. You want to support the immune system. And this is where really the healing takes place. Things like L-glutamine is very healing to the gut, aloe vera, marshmallow root, slippery elm, which is my favorite. If we go to the next slide, you'll see that it's my #1 herb for gut healing, slippery elm. And it's very easy to find, and you can just make what I call a slippery elm gruel. You take 1 teaspoon of the powder and you mix it with stevia, which is your biofilm buster that I spoke about, and add 2 cups of water. Mix it very well and drink 1 or 2 cups a day. And it's so harmless that you can even give it to infants who have, upset stomach or colic, things of that nature. So I really love slippery elm. And then the final stage, the fourth R, stands for Re-Inoculate. So this is where we start introducing the good bacteria, the bacteria that are really helpful to the gut. And they're very anti-inflammatory. And you want to really emphasize in infants in particular, Bifidobacterium and Lactobacillus bacterium in the first year of life. Kids on the spectrum, as the research stated earlier, do really well on Lactobacillus rhamnosus, Lactobacillus rhodori, and Helveticus for anxiety issues and OCD type issues, as we sort of illustrated in the earlier data. You have to be careful with the probiotics because, again, kids with histamine issues, there are certain bacteria that really do produce a lot of histamine. And that would be the rhodori bacteria that I just mentioned, Lactobacillus bulgaricus and KCI. Those are the big histamine producing bacteria. There are bacteria that help to reduce or degrade the histamine product that's produced in the body. And that would be Lactobacillus infantis and plantarum and Bifidobacterium longum. So they help to get rid of some of that excess histamine in the body. Another great treatment strategy in this section would be the introduction of prebiotics. And I'm sure everyone's really familiar with using inulin. And I think why inulin is so effective is because it's been shown to increase bifidobacterium. So, and it also helps produce those short chain fatty acids that are very healing to the intestinal lining. And the short chain fatty acids like butyrate are the preferred fuel for colonocytes, or the cells within the intestinal tract. Here you can also introduce those fermented foods that I spoke about. Again, being cautious with histamine. And
Dr. Glazer, because you mentioned that there are certain probiotics that can also trigger histamine, and then fermented foods, and fermented foods are very readily available in Pakistan, and people are pretty good at fermenting things and making their own yogurts and probiotics. What could be something that you can tell them that they can address on their own, but also be mindful of histamines? What can they watch out for? What does histamine reaction would look like?
Well, unfortunately, I mean, there's the traditional, hives and eczema and things like that. But I mean, unfortunately, histamine can also disrupt the blood-brain barrier and create behavioral problems. So, I mean, I think a good test would be if you do use these things and you find that, my son went crazy when I started introducing these fermented foods, that's a pretty good idea that you've got a histamine problem. So yeah, there's not one thing that you can look for, but I mean, obviously the skin stuff, the hives, perhaps even headaches, fatigue, things like that, sleep problems even. So I think if you're going to introduce fermented foods and you start to see problems arise, that's when you should become cognizant of the fact that, okay, maybe there's a histamine problem here. Okay, and the last slide I have here is just another study showing evidence of high levels of arabinitol, which is a biomarker for yeast overgrowth in children with autism. So this is actually evidence stating that probiotic supplementation led to a significant decrease in the arabinitol, or arabinose, as some of us might know, biomarker after using probiotics. So as you can see, it has a profound effect. It's a great way to manipulate what's going on in the gut. I think there's, a ton more research that has to be done, but, I think we're getting there. I think there's a lot that's been done, and I think it's really positive, and it's just really exciting. So I think I've covered everything that I wanted to cover. We can open to some questions.
Yeah. Dr. Glaser, you were going to, I want you to be the one to make that announcement about your special rate for seeing.
Oh, right.
Yes.
I almost forgot. Thanks for keeping me on my toes.
No, it's all good.
Okay. Batul and I have decided that if anybody is interested for the community, I'm going to offer one-on-one consultations for those families that are interested at a reduced rate. So all you have to do is say that you are at the lecture or you're part of Batul's community, and we will work, or I will work on a sliding scale. Should I say the price?
Yeah, well, we can let you guys know the price when you contact Dr.
Glaser. Yeah, so let's just say it's significantly reduced, and I'm doing this as a favor to the community and to open up access to people that may not have been able to as a result of the cost.
Thank you so much, Dr. Glaser, for that. This means a lot to the Pakistani community, because we're at a place right now where we need more people like you to come forward and help members of the community with knowledge, with education, with guidelines. And what the work that you've done with us today is amazing. For that reason, we've all learned something over here today. So that was the big announcement from Dr. Glaser. We will move on to the questions. If you guys want to make an appointment with Dr. Glaser, her information is up on the slide, which is presenting right now, and you can contact her directly, let her know. Any one of you who is from Alina's group or my group, or in need of medical advice for autism, you can feel free to contact her. Dr. Glaser, I have a list of some questions over here. Okay. The main one is people are asking, what does it mean when their children are reacting to probiotics? I know we discussed histamine being one, but what else could be the reason? Why would they be reacting to probiotics, as in not sleeping well, or self-stimming behaviors increasing even more? What would that mean?
Well, that's a good question, because it's actually pretty common. Sometimes kids on the spectrum are dealing with something called Sibo, and that stands for small intestinal bacterial overgrowth. And actually, probiotics make the whole situation worse. So that if they are reacting to the probiotics, there is a simple test that can be done. And it will test for the different gases that these bacteria release. And I would really get that test done, because they are contraindicated in Sibo. There's only a specific form, and it's the spore-based probiotics that should be used in Sibo, because otherwise you're actually just adding fuel to the fire. So that would be one of the reasons. Another reason could be that the gut is in absolutely no state to be starting to re-inoculate. It's just not healthy enough to even grow or have these different bacteria grow in the environment. So I think maybe you need to take a step back and heal up the gut. And then once it's in a better state, less inflammatory, then you can try the probiotics again. But it's a very common complaint. And maybe it's just too early of an introduction for the probiotic.
Sounds good. So when you say improving the gut, you mean through the diet, the first step of your R, right? From the 4 Rs would be from the
Yes.
removing. Gotcha.
Yeah. So that's why like the Re-Inoculate was step number 4.
Yeah.
And people tend to like really just jump in and immediately give probiotics. And then because they reacted negatively to them, they never want to touch them again.
Yeah.
So I think that's doing a really big disservice because I think they can have a profound effect, but maybe it was just at the wrong time.
Yep. There's also a question about the cognition, and we have obviously discussed a fair few research papers. Can the cognitive abilities improve by addressing gut health, specifically like learning difficulties? We know language delay can, but cognition and yeah, global development, do you think that can improve as well?
Absolutely. Because I mean, if the gut is inflamed, we know that the brain is inflamed and it's not able to do what it's supposed to do. So always, always, always treat the gut first. Yeah, I think it can have profound effects on many different levels of brain function. It's not just the behaviors. That's what I focused on today, because there's a ton of research out there right now for, you know, its effect on depression and its effect on anxiety and its effect on OCD and self-injurious behaviors. But yeah, I think it can have an effect on a child's ability to learn, a child's ability to speak. And when you say delays, like global delays, you mean like physical delays, like motor development, that type of thing?
Yeah, well, it's more like cognition, learning difficulty, learning disabilities, that sort of stuff.
Oh, most definitely. Most definitely.
Yeah, so we're also live on Facebook, Dr. Glazer. So I have shared with you the questions that we had over here. We also have some questions from the Facebook.
Okay.
There's a question about what does bitters before meals mean?
That means, that's a good question, actually. I should have clarified that. Taking like a bitter herb, I like to suggest something like gentian is a really good herb, a single bitter herb that you can take 20 minutes before your meal. And what that does is it primes the digestive system to eating. You start secreting your own digestive juices, like your pancreatic enzymes and your hydrochloric acid. And instead of taking something exogenous, like a digestive enzyme, you can prime your own digestive juices if you take a bitter 20 minutes before a meal. So get all those juices going. And that is a really great way to help with the child's digestion.
And besides the gut health, and because we have obviously discussed about various aspects of gut health, what would you suggest would be good for constipation?
Constipation, well, I mean, the studies have shown that Clostridia is a big culprit when it comes to constipation. So you have to decide whether you want to do some testing or just empirically assume that the child has Clostridia overgrowth. So you want to deal with that. Also Sibo, the methane producing gases from the methane bacteria in Sibo can also be a big culprit when it comes to constipation. So you'll have to get to the root cause and try and figure out what that is. But if you want to just try like a remedy, I've had a lot of success with aloe vera juice.
Fantastic. There's a question about Trianza enzymes. I'm not familiar with this. Is that something you can expand upon, Dr. Glazer?
I'm not like super familiar with them. I can't really comment, but from what I know, they're a pretty good company, but I haven't used them personally.
Gotcha. Melatonin induces central precocious puberty. Is that something that can happen?
Meaning like early puberty?
I suppose that's what it means, yes, or that's what the poster is trying to say.
Okay, that's the first I've heard of that. I'd be interested to see a study on that because I have never come across that. I mean, melatonin is a wonderful, it's a hormone. It's extremely anti-inflammatory. It's a major antioxidant. I've only heard amazing things about it. So I'd be interested to see that study and I'll look it up after we're done.
So I think I have addressed it. Alina, have I missed questions? Because I'm there. And I think
There are a few questions in the chat box as well. I think Abdullah Bhai, he wants to ask the approach of Dr. Glazer. What is your approach
What is my approach?
Towards biomedical?
Okay, well, I mean, I do, my approach is basically looking into the root cause. I do a lot of an in-depth history of the child before any lab testing is done. Then we choose the specific lab tests that need to be done to look deeper into what might be causing some of the biochemical imbalances. I only use natural products because I'm a naturopathic doctor, so I don't tend to use antibiotic therapy or antifungals like prescription drugs. I don't do anything like that. So everything is natural, and it's very individual. I would definitely say that the gut approach is very much at the forefront of my treatment. It will be the first place that I start because, as I said before, there's so many bacteria in our body. It outnumbers all the cells in our body. So if we don't address that first, then we're not really going to get too far. So dealing with the gut is usually at the forefront of my treatment. And then once that's in order, then we move along looking at mitochondrial dysfunction and looking at heavy metal detoxification and whether that's an issue. And then we look at methylation. And I mean, there's just so many things that you have to go down the list. But I tend to start in the gut for sure.
And Dr. Glazer, there's this one good question. In the 4th R stage, are prebiotics required for all children, or do prebiotics interfere with someone who has Sibo?
That's a good question. Okay, the first part of the question was,
are they required for all children in the fourth stage?
No, I mean they're not, and I know that the Nemechek protocol. I know this question is stemming from the Nemechek protocol because he is, adamantly against the use of probiotics. I think if there's like a severe dysbiosis with like major skews and all the bacterial biomarkers, I would definitely say that we would need to use at least a single strain of probiotics, but prebiotics definitely help. But if the good bacteria isn't there, feeding them doesn't do anything, right? So, I mean, the inulin is like their food to help them flourish. But if they aren't there to begin with, then, in some instances, I think you definitely need some probiotics.
Okay.
And the second question was, are prebiotics contraindicated in Sibo? In some cases, yes.
Okay.
Definitely can worsen the situation.
So we also have a question around CFD. And I know that we've kind of addressed it with the paleo diet, which is dairy-free, grain-free, and gluten-free. So guys, we did discuss that. But just to kind of come back to it with CFD, the cerebral folate deficiency, obviously there is this concern even with camel milk that it can impact our kids negatively. Because we're supposed to avoid all forms of dairy, even camel milk. So what are your what would be your views about that? I mean, they cannot do frat testing in Pakistan, and the most effective way is lumbar puncture, and that's not even available in Canada right now. So I'll be surprised if that is being done in Pakistan. So what options do families have to navigate that?
Well, I think if you suspect a folate deficiency and a receptor, like an autoimmune issue, I would probably stay away from camel milk then, because there really isn't any research out there regarding that at this point. And my recommendation would be to avoid all dairy products at that point.
Yep. Okay. So I think that's something that we have covered. And Dr. Glaser, you'd continue to come online with us in the next few months, I would imagine, and discuss various aspects of the 4R as well, I hope, on behalf of the community.
Hint, hint.
Detoxes and methylation and, all these other wonderful questions that people have. And I see there's a lot of questions about chelation, but as we've discussed, that is usually the last step.
It is. It really, really is, because it can make your kids a lot worse. Yeah. So I think this is a really great place to start. And even if it just brings it to people's awareness, the importance of it, I think then that's all I can ask.
Fantastic. Alina, I think we've covered most of the relevant questions. I know questions will continue to pour in. Yeah. We will see Dr. Glaser in the future as well, inshallah. Is there anything you'd like to add, Alina?
No, nothing. Just Nida Rashid, she's saying her question is still not answered. Can you please check that? Just one more question.
Nida, can you? Oh, how many times a healthy child should pass out stool in 24 hours?
Well, I usually say that obviously for optimal health, you want to see a bowel movement every time you eat. So if you have 3 meals a day, you want to have 3 bowel movements a day. But the reality of the situation is that's not usually what's happening. So if a child could have at least 1 bowel movement a day, that would be ideal. Or the bare minimum. Skipping a day, especially when you're doing some sort of, antimicrobial work where you're killing the bacteria and they're releasing toxins, you need to get these things out of the system so we don't have an auto intoxication going on. So if the child's not having a regular bowel movement, then I would not recommend starting this. So first, that's a very good point, actually. First and foremost, you have to make sure that your child is having 1 bowel movement a day, because doing something like an anti-candida protocol and not going to the bathroom, you're just setting yourself up for an absolute nightmare.
Yep.
So
that's
thanks for that question.
Good question. It will be very helpful to know that. There was one thing about mitochondria, and I feel like we have talked about this, but I'll just repeat it again. Can treating the gut help with mitochondrial disorders and mitochondrial?
Well, in an indirect way, yes, because when you have a dysbiotic gut or an inflamed gut, but particularly a dysbiosis within the gut, these bacteria release toxins. These toxins circulate and damage the mitochondria. So by cleaning up the gut, you're getting rid of the toxins that they produce that have been shown to damage mitochondrial function. So that's the sort of the connection there. But there's other things that damage mitochondria as well. So there's chemical toxins, heavy metal toxins. So it's one of the many. But the infections definitely, because of the toxins that they release, damage mitochondria, also damage the blood-brain barrier. So the answer is yes.
The answer is yes. Excellent. And Dr. Glaser, this last one, which I know because there are a lot of families who are coming to the table a little bit later because there is not much awareness of biomed in Pakistan, and Alina's working so hard in making sure that she's creating that knowledge. Question is it too late to work on the gut or the gut health? What if the child's a little bit older, 10, 11, 12? Are we too late to the party, or would it still help?
I don't think you're too late. I think it's going to take longer to see an effect for sure, because the problems have been around probably much longer. I think that, you know, when you look at leaky gut, for instance, if you can heal the gut up, you're going to reduce the amount of inflammatory mediators within the body. So you're going to improve behaviors that way. You may not be able to fix or change the species within the microbiome, because I did show you that study that there's a critical window, but that's not talking about the inflammation within the gut and the gut lining. So you can always work on the gut and it will have an effect on the rest of the body. So no, you're never too late.
We really needed to hear that. Thank you so much, Dr. Glazer. Alina, can I pass it on to you for a few words?
Thank you so much once again. We have surely learned a lot from you. I'm sure there's so much we got from your presentation today, and those people who couldn't join us, they are going to definitely watch it later on. Thank you once again, and that's it. I just wanted to say, if anyone else has any question, you can post in the comment section on Facebook. We will try our level best to reply that. Thank you once again.
Thank you so much, Dr. Glazer. We will be sharing the link of the recording with you as well. And we sure hope to see you back on this platform again soon with more information for us. And we will share your contact information with the community. It's in the slides anywhere.
Thank you so much for having me. It was a pleasure to speak with you all today.
Thanks, Dr. Glazer. Take care.
Bye.
Thank you so much everyone for coming. अगर आपका कोई question रह गया है या कोई ऐसी चीज है जो आप नहीं understand कर सके तो please आप Facebook पे post कर दीजिएगा. हम पूरी कोशिश करेंगे कि उनको answer करें. अब्बास बुखारी, आपने क्वेश्चन किया था कि टेस्टिंग कहाँ से होती है. वो मैं बताना चाहूंगी कि डॉक्टर सना है इस्लामाबाद में और डॉक्टर फायजा है लाहौर में. आप उनके थ्रू जीपीएल से टेस्टिंग करवा सकते हैं, ठीक है. और जो लोकल कुछ टेस्टिंग है जो कि आपको मैप्स डॉक्टर सजेस्ट करते हैं वो आप अपनी लोकल लैब से भी करवा सकते हैं. Anyone else?
अलीना, हिस्टामीन्स के टेस्ट कहाँ से पता लगते हैं? हिस्टामीन्स इंटॉलरेंस के.
निदा, एक्चुअली जो हिस्टामिन इंटॉलरेंस होती है ये तो सबसे पहले एनीथिंग कैन ट्रिगर हिस्टामिन, ठीक है. आपकी बॉडी में कोई भी वायरल इन्फेक्शन हो जाए, कोई चीज आप खा लो, कुछ भी ऐसा हो उसकी वजह से हिस्टामिन ट्रिगर कर सकते हैं. ज्यादा आप सिम्टम्स यही, जैसे डॉक्टर ग्लेजर ने भी कहा, अब देखो बच्चे के अगर चीक्स बहुत ज्यादा रेड रहते हैं या कान बहुत ज्यादा रेड रहते हैं, वो एक हिस्टामिन का हो सकता है. कोई चीज खाते हैं एकदम से उसको बॉडी पे रैशेस हो जाते हैं, छोटे छोटे से दाने निकल आते हैं, वो हिस्टामिन को. एक्चुअल में कोई ऐसा नहीं है टेस्ट जो कि हिस्टामिन को डिटेक्ट कर सके. एक डाओ एंजाइम होता है जो कि हिस्टामिन को प्रोसेस करने के लिए लाइक यू कैन से कि जिसकी टेस्टिंग होती है. आई एम नॉट सो श्योर कि पाकिस्तान में वो अवेलेबल है, लेकिन सिम्टम्स बहुत अच्छे से नजर आ जाते हैं जिनको हिस्टामिन के इश्यूज होते हैं. और कोई क्वेश्चन? Anas Nishan, team explains slippery elm. Slippery elm जो है एक herb sort of species है, herbal. वो यहाँ से पाकिस्तान में तो मैंने नहीं देखी, लेकिन आप लोग बिल्कुल ऑर्डर करवा सकते हो. कुछ यहाँ पे स्टोर्स हैं जो कि आपको ये इनका टिंचर्स भी मिल सकते हैं और इसके आई थिंक ये herb जो से मिल भी सकते हैं पाउडर फॉर्म में, तो ये आप ले सकते हैं. Anyone else?
हेलो, अस्सलाम वालेकुम.
वालेकुम अस्सलाम जी. अफशा.
हाँ जी, मैं पूछना चाह रही हूँ कि ये गट से कौन सा डॉक्टर इसको डील करता है? मतलब गैस्ट्रोएंटरोलॉजिस्ट है या इसके लिए स्पेसिफिक कोई स्पेशलिस्ट है?
अच्छा अफशा, देखिए अगर तो स्पेशल नीड्स बच्चे की बात हम करते थे उसके लिए कोई प्रॉपर ऐसे लोग होने चाहिए जो कि सर्टिफाइड हो स्पेशल नीड्स बच्चों को ट्रीट करने के लिए, ठीक है। तो उसके लिए यही है कि आप मैप्स या डैन डॉक्टर्स को कंसल्ट कर सकती हैं, जो कि ज़्यादा बेहतर तरीके से आपके बच्चे को अंडरस्टैंड कर सकते हैं। ऑब्वियसली गैस्ट्रोएंटरोलॉजिस्ट ने दे गो बाय द बुक, उन्होंने एक नॉर्मल जो हम न्यूरोटिपिकल लोग होते हैं उनके बारे में सारी चीज़ें उस तरह से पढ़ी होती है। ऑटिज्म इज अ टोटली डिफरेंट जॉनरा और एक डिफरेंट चीज़ है, तो उसमें आपको बहुत इन डेप्थ खुद भी रिसर्च करोगे तो आपको आइडिया होगा कि बेहतर कौन सा डॉक्टर हो सकता है। अगर आप हमसे पूछे तो वी विल से कि आप किसी प्रॉपर मैप्स डॉक्टर के पास जाओ।
कौन से, सॉरी?
मैप्स डॉक्टर्स होते हैं मेडिकल एसोसिएशन ऑफ पीडियाट्रिक्स और स्पेशल नीड्स, जो स्पेशल नीड्स बच्चों को ट्रीट करते हैं।
ओके ओके, अच्छा, थैंक यू।
अलीना, मुझे स्टीविया के बारे में पूछना था कि इस्तेमाल किया जा सकता है डाइट वाले बच्चों के साथ।
फिर
बारे
जैसे
में
भी
बताइए।
डॉक्टर ग्लेजर ने भी रेकमेंड किया कि स्टेविया शुगर आप यूज कर सकते हो। लाइक स्टेविया के बारे में जहाँ तक मैंने पढ़ा है उसके बारे में बहुत ही डिफरेंट व्यूज है। कुछ लोग ऐसे कहते हैं कि बिल्कुल इसको इस्तेमाल करें, इट इज गुड फॉर गट हेल्थ, जबकि कुछ रिसर्चर्स ये भी कहती है कि स्टेविया से लीकी गट होता है। तो आई ऑलवेज से कि जब भी कोई पेरेंट्स पूछते हैं तो देखिए जो हमारा हनी है ना, ऑर्गेनिक हनी, दैट इज द बेस्ट फॉर्म ऑफ स्वीटनर जो कि आप इस्तेमाल कर सकते हो, लेकिन शर्त ये है कि या तो मनुका हनी हो या ऑर्गेनिक हनी होना चाहिए। एनीथिंग एल्स?
Excuse me, Assalamualaikum. If the child is sometimes constipation, sometimes diarrhea, what is this situation and how can we handle in this situation?
Nusrat, again, it comes to the gut dysbiosis. You have to check what is causing the constipation and what is causing the diarrhea. ठीक है, ऑब्वियसली अगर आपकी माइक्रोबायोम जो है उसमें इम्बैलेंसमेंट आ रही है तो दैट मीन्स के इश्यूज आ रहे हैं। फिर माइटोकॉन्ड्रियल डिसफंक्शन भी एक बहुत बड़ा कॉज हो सकता है कॉन्स्टिपेशन का। अगर आपके बच्चे का माइटोकॉन्ड्रिया इतनी एनर्जी सेल्स के लिए प्रोड्यूस नहीं कर पा रहा तो बच्चे कॉन्स्टिपेटेड रहते हैं। और फिर यही है कि आप किस तरीके से उसको डाइट दे रहे हो, ये भी बहुत ज़्यादा मैटर करती है। नीट एंड क्लीन आपकी ऑर्गेनिक डाइट है कि नहीं, जीएमओ डाइट तो नहीं है। जितना आप कोशिश करेंगे नॉन जीएमओ डाइट को, ऑर्गेनिक डाइट को फॉलो करें, उतनी ज़्यादा बेहतरी आएगी आपके बच्चों में।
थैंक यू। बट इसके लिए कोई टेस्ट एडवाइस कर सकती हैं आप कि हमको कहाँ लेके जाएं स्टमक के टेस्ट के लिए? फाइनल टेस्ट हो।
नुसरत, अगर इसमें वही चीज है कि अगर तो आपने बैक्टीरियल ओवरग्रोथ को करना है तो फिर आपको स्टूल टेस्ट करवा सकती हैं, और इसके अलावा जीपीएल से टेस्ट होते हैं, ओट्स टेस्ट जरूर करवाएं। फूड एलर्जी टेस्ट होना आपके बच्चे का जरूरी है, हो सकता है कि कोई फूड ऐसा हो जो कि उस तरह के इशू कॉज कर रहा हो।
He is cheese allergic. My son is 30 years old, but he is cheese. Sometimes he takes any pizza with cheese. He is
Okay,
allergic.
he is allergic to okay, तो वही डेयरी तो बहुत बड़ा फैक्टर है। अगर आप डेयरी और ग्लूटेन के बारे में रिसर्च करें ना तो ये तो हमारे बच्चों के लिए बहुत ज्यादा इश्यूज कॉज करते हैं। तो आप इसमें देखिए, अगर आपको लग रहा है कि एक चीज आपके बच्चे के लिए हार्मफुल है, then you should stop it. You shouldn't be giving it.
I will stop.
Stop it. That's good.
Okay. Thank you so much.
Thank you very much, everyone.